Thank you, Mr. Chairman. It's my great pleasure to have here to introduce the status and advances of contrast-enhanced ultrasound application in China. As a time limited, and also I have the Chinese PowerPoint in other side, so it's more easy to understand my speech. So that is, I will save and shorten time. There are following 4 parts to introduction. First of all is a overview of contrast-enhanced ultrasound used in China. As we all know, commercial ultrasound contrast-enhanced have been widely used worldwide, and currently there are 4 import agents available in Chinese market, and also include Sonoview, Definitive Optison, and Sonozoid. And also, there are 2 kinds of import CEUS application for cardiac disease. It include the it's an import CEUS application in China, including the Sonoview, Sonozoid, and Definitive. Another, the further is international for use in the liver. And Sonoview has been approved in 2004, mainly used for the liver, the superficial organ, cardiovascular, and so on. And also Sonozoid has been approved in 2018 and special used for the liver. And Definitive had completed the phase 3 clinical trial in China. Until now, more than 3,000 CEUS papers have been published in international journals. We can see the CEUS mostly used in the liver, the cardiovascular, and hypoxia. And also 2 kinds of domestic CEUS can be used clinically and especially used for cardiac disease. And this pie chart shows the CEUS usage in China. We can see the Sonoview accounts for about 95% in China. Sonozoid and others take about 5%. And also the number of hospitals using CEUS in China, we can see it's rapidly climbing year by year in China. By 2019, there are about 2,000 hospitals use the CEUS. And this column diagram showed the CEUS usage in different levels of city. We can see the big city like 1A and 1B have the big contribution for usage of CEUS. But even though we can see in the big city, 1A and 1B is in less than half of coverage. So they still have the great potential Chinese market of using CEUS in China. And depending on the different levels of hospital, we can see the big hospital, class 3 hospital, has a big contribution. And also CEUS used for both the diagnosis and the treatment according to different organ. we can see the liver, the superficial, the interventional procedure, and the hycosis occupy to the most of organs. And in the CEUS publication, Chinese doctors contributed a lot. 35% of international journals from Chinese research, which more than half of those published are on interventional procedure. And also, this is the Chinese guideline for diagnosis and treatment of primary liver cancer. We can see CEUS is recommended as a first-line modality for primary liver cancer after detection by B-mode US. And also, CEUS is widely recognized by clinicians and recommended by several clinical guidelines in China, like the Chinese Medical Association and the Chinese Medical Anti-Cancer Association, and so on. And also, 6 Chinese doctors participated in the 2020 liver guideline by WFUMB, which fully proved the contribution of the Chinese ultrasound doctor. The secondly, CEUS used for both diagnosis and interventional procedure. CEUS used for diagnosis according to the different organ, we can see the liver, the superficial, and the hycosis. It's the top 3 organs. The diagnostic CEUS in the liver, Chinese doctor devoted a lot. In recent years, the study merely focused on the CEUS LIRAS to differentiate HCC and other occupied liver lesion. This study from Dr. Li using the meta-analysis to effectively distinguish the HCC from other hepatic malignancy in high-risk patients, and also diagnostic CEUS in breast. Internal homogeneity and peak intensity percentage of CEUS may provide early identification of pathological corresponse to the new adjuvant chemotherapy. And also, if CEUS demonstrated the good sensitivity in detecting breast cancer, and if combined with the MRI, it can optimize the diagnostic specificity and accuracy in breast cancer prediction. And the diagnostic CEUS in thyroid, compared with the conventional ultrasound, CEUS is more valuable and no-invasive imaging modality to detect the extracapsular extension. And if the CEUS compare the SWE and ACR TRAS, can contribute to a reduction in the number of biopsy performed on benign nodules. And also, CEUS have been widely in gynecology. Use the 3D and 4D is a highly useful method for diagnosis tuber patency, and with the high sensitivity and specificity. Interventional CEUS covers from diagnosis and treatment, including biopsy, ablation, and intracavity. I think this topic will give the introduction in detail this morning. The last speaker from England, Professor Huang. So as a time limited, I only introduce the CEUS used for ablation. Before ultrasound-guided ablation, we can use CEUS to candidate selecting and therapeutic planning, and also assessment of the tumor size, shape, and predictor intrahepatic recurrence of HCC after the therapeutic response. And also, during the thermal ablation, we can use CEUS to detect HCC blood vessel and assess the therapeutic response immediately. And also, we can use CEUS to observe the severe complications immediately, like the hemorrhage and other severe complications. And after treatment, CEUS merely used for therapeutic effect evaluation, including after the TACE, ablation margin, safety margin, and the short time and the long time effect. Actually, CEUS not only used in the neoplasm, but also can be used in parasitic disease. As we all know, echinocosis is a very high incidence involved in Xinjiang, Qinghai, Xizang, and Gansu province. The annual incidence of alveolar echinocosis is about 16,000, and merely in the Qinghai province, the infection rate in Sanjiangyuan area is about 10%. This table showed the CEUS for the hepatic echinocosis. We can see the CEUS can be more accurate, the sizing, the viable HHE, and the features of small lesions, and detect the small lesions of hepatic echinocosis. This is an example. A young man was detected hepatic echinocosis 3 years ago, and the patient takes albendazole for 2 years, but with not other treatment. And also blood tests reveal that the echinococcus specific antibody, HBV antigen and antibody, and the DNA are positive. Conventional ultrasound reveals the multiple lesions in the liver. We can see segmental 6 and the 7th lesion with an unclear boundary. This is a very typical findings of the echinocosis CEUS findings. We can see the contrast enhancement of the non-calcified area around the lesion. You can see the enhancement at the periphery of the lesion. And before microwave ablation, biopsy were performed in the S6 and 7 respectively. Use the coaxial biopsy needle guided. And pathological diagnosis reveal that the hepatic echinococcosis for the types is alveolar habitat, both for S6 and 7. And on the ultrasound guidance, we placed the antenna into the lesion and ablated the lesion. We can see at the one time. And after treatment, contrast enhanced ultrasound revealed that the complete necrosis can be obtained for S6 and S7. Thirdly, I would like to introduce CEUS-based AI for diagnosis and treatment. And as we all know, AI research in CEUS has become the hot topic in recent years. And most of AI research in CEUS mainly focus on the differentiating of the benign and the malignant tumor. This is an example using the SUM to develop a model. We can see CEUS-based AI strategy improved performance both for experienced and inexperienced doctors. For the ACC value improved significantly, especially for the AI disagree with inexperienced. It can improve the ACC value significantly. And also, this study showed the AI assist identified the malignant versus the benign liver lesion. We can see for the residents, they can improve the performance significantly. And also for the experts, they also can significantly improve the ACC value. And also significantly improved both the expert and the residents for significantly. And also AI research in liver lesion can to differentiate diagnosis for untypical HCC, FNH. This study revealed first based on the texture and distribution and the edge-based feature and the washout velocity feature to develop a model. And the results reveal that the good merit for automatically differentiating untypical HCC and FNH. You can see this study improved ACC value significantly. And also effectively integrate radiologist domain knowledge, including the diameter, shape difference between ultrasound and the CEUS, the artery and the first half of the venous face into the deep learning model for diagnosis malignant versus benign breast tumor. The ACC value can reach 0.86. And this study revealed that the CEUS-based hierarchical temporal attention networks for steroid nodule recognition. And the study revealed that the uniform dynamic CEUS can enhance the future learning and hierarchical nodule classification into tumor nodule diagnosis model and achieve the good ACC value can reach 0.8. And the AI research in CEUS for treatment merely used for the prediction any kind of minimally invasive treatment, including TACE, ablation treatment, and predict immunohistochemical index of HER2 for breast cancer. And this is an example. Using the deep learning-based radiomics can effectively utilize the CTS science to achieve accurate and personal prediction for response of HCC to first TACE. This study is from Professor Xie's study. And also, as we all know, the early HCC can be treated by use the surgical resection or the ablation. How to choose which patient can benefit from the ablation or the surgical resection. This study review use the radiomics model achieve accurate preoperative prediction of PFS for the radiofrequency and the surgical resection, and also 17% RFA patient and 27% surgical resection patient should exchange their treatment. Their average probability of 2-year PFS would increase 12% and 15% respectively. This study also from Professor Xie's team. And also CEUS model significantly improved the prediction performance of early recurrence compared to the conventional ultrasound. However, if CEUS compared with the ultrasound radiomics and the clinical factor could stratify the high risk of the later recurrence, the AUC value can reach 0.77. And also for the breast cancer, this study compared with the model based on multiple static CEUS imaging. The model combined with the static CEUS imaging and the temporal features could achieve much better prediction performance. The AUC of predicting HER2 immunohistochemical index increased significantly. And last, future development of new CEUS technologies. As we all know, the ultrasound transducer transmitted the fundamental frequency into the tissue. It's a fundamental frequency. And the CEUS is nonlinear imaging to enhance the contrast of the microbubbles to around the tissue under the relatively high incidence of acoustic pressure. So currently, the second harmonic signal is generally used for CEUS imaging. And the subharmonic signal is half of the fundamental frequency, and the superharmonic can only be emitted from a microbubble, non-linear oscillate, not from around the tissue. So around the tissue can also generate second harmonic at a relatively high incident acoustic pressure. So we can see if we use the second harmonic imaging, we can get a lot of background noises for CEUS. However, if we use the subharmonic CEUS, we can get the more clear and has a negligible signal for the subharmonic. That means the light background noise in the subharmonic imaging. So that is the benefit of the subharmonic imaging. And also, we use the super harmonic CEUS imaging can detect the microvascular more sensitively, and we can see the micro vessels density and tortuosity so clearly compared the second harmonic imaging. And in the future, maybe CEUS localization microscopy with super resolution vascular imaging. This technique is the first acoustic and detected and isolate, localize, and finally they can trace the signal microbubbles movement with a high frequency and spatial resolution. So it's so clear we can trace the signal microbubble movement in the future maybe. And also if we use the super resolution ULM imaging to detect the organs, the different organs perfusion. This is an example for the kidney perfusion in the rats. We can see that's so clear and so lively to demonstrate the kidney perfusion is much better than the angiography. And also clinical pilot application of super resolution ultrasound ULM imaging for breast cancer. The firstly, beam mode imaging with the tumor ROI market in this area. And we can detect the occurrence of the microbubbles and the velocity of microbubbles and the direction of microbubbles. So it's so clear at the different area of the breast cancer. And the CEUS imaging based on non-invasive internal pressure estimation, and the signal amplitude and is inversely linear proportion to the ambient pressure. So 5 kinds of contrast enhancement agents have high correlation. That means that's a good linear regression we can see. And also the amplitude of the subharmonic signal from microbubble is potential to non-invasively assess the blood pressure gradient, and maybe in the future can be used to diagnose the portal hypertension. This is an example we can see. Use the calibration, we can get the intracardiac pressure. The yellow line is use the catheter to get the intracardiac pressure, and use the shape, we can get the green line. There have a good correspondence between the shape and the catheter. And also maybe the most sensitive, the severe complication measurement to blood pressure changer. And also this is a preliminary clinical trial obtained in all 45 patients, we can see they have a strong correlation between the severe portal hypertension and subharmonic gradient, and also no invasive pressure estimation with phase change ultrasound contrast agents. This is a very new technique. As we all know, the tumor interstitial pressure is much higher than the normal tissue, and high tips impede driver delivery for effective chemotherapy. And also we need to know invasive tip assessment, monitor chemotherapy response. So the phase change ultrasound contrast agency can activate the nanodrops into the microbubble. So the high ambient pressure need high incidence acoustic pressure. So it's a potential way to non-invasively assess the tumor interstitial pressure measurement. So the conclusion, the Chinese ultrasound doctor have generated a large number of publications in CEUS, which covers almost every hot topic for diagnosis and treatment. China is a big country, but not a strong country in the application of CEUS. Our original study needs to improvement with high research quality and high level of evidence-based medicine, and therefore can be referenced by more international journals and international guidelines. And the CEUS-based AI for diagnosis and treatment can benefit image feature extraction and progressive analysis. And also the new techniques of including subharmonic improvement of the accuracy and the resolution of CEUS imaging, and the CEUS-based non-invasive internal pressure estimation may bring in a bright future. At last, I would like to introduce the AFSUMB 2021. This meeting will, in conjunction with the CSUM, will be held on September 6th of this year. The theme of this conference is Better Asia and Better Earth. Your active participation will really appreciate. Thank you for your attention.